Hello everyone, today, I would like to share a case of acne. It involved a teenage boy who had been suffering from acne for over a year. The small breakouts started a year ago, which he initially ignored. As time passed, the acne became more numerous, red, swollen, and painful. He visited many hospitals and tried various internal and external medications, but the results were not very good. When he came to me, his face was covered in acne, red and swollen, forming connected patches. He looked lethargic, tended to sweat a lot, had a normal appetite and sleep, strained during bowel movements, suffered from constipation, had no urinary issues, had a red tongue with a somewhat yellow, thick, and greasy coating, and his pulse was slippery and rapid. Acne is a common condition, and many of us have experienced it to some extent. Generally, we associate acne with internal damp heat. This boy also had constipation, indicating internal heat. The red tongue with a yellow coating suggested heat, while the thick, greasy coating indicated dampness. The slippery pulse pointed to dampness, and the rapid pulse indicated heat. All these symptoms together suggested damp heat. Where does this damp heat come from? One source is the consumption of spicy, sweet, and greasy foods, which traditional Chinese medicine terms as rich and thick flavors. These foods can generate internal heat. Moreover, they can hinder the spleen and stomach's function, leading to impaired water metabolism in the body and resulting in damp turbidity or phlegm dampness. This dampness combined with internal heat forms damp heat. Indeed, this boy often consumed fried and sweet foods. As for teenagers, they are in a phase of robust qi and blood, with a tendency towards excess yang heat in the body. This constitution combined with internal damp heat can lead to acne. Following this logic, the condition doesn't seem complicated, right? In fact, for many teenagers, damp heat might be the sole cause of their acne. However, for this boy, the analysis was not comprehensive enough. Looking back at his symptoms, he lacked energy and sweated easily. What does this indicate? Firstly, the lack of energy suggests deficiency. Where is the deficiency? In lung qi. Why? Because the lungs govern the skin and hair and control the opening and closing of the pores. Weak lung qi affects the pores functioning, leading to easy sweating. But does sweating necessarily mean lung qi deficiency? Yin deficiency can also cause sweating, as can phlegm dampness. However, yin deficiency usually presents as night sweats and a red tongue with little coating, which our patient didn't have. Phlegm dampness could cause sweating, but it usually results in sticky stools, whereas our patient had constipation. We have previously mentioned that constipation indicates heat accumulation in the stomach and intestines. However, bowel movements can also reflect the state of the internal organs. Considering the relationship between the internal organs and the meridians, the lung and the large intestine are interconnected. The lung houses the pipa, hence the anus is also called the pipa gate. This name suggests that the anus is another gateway of the lungs. Normal lung function and sufficient lung qi ensure smooth bowel movements. Weak lung qi can lead to impaired large intestine function, resulting in constipation due to qi deficiency. This type of constipation, marked by straining during bowel movements, differs from the dry, hard stools caused by heat accumulation in the stomach and intestines. Therefore, this boy's condition was one of external deficiency and internal heat. Externally, lung qi deficiency made the skin loose, allowing external pathogens to invade the body. These pathogens combined with internal damp heat, lingering and transforming into toxic pathogens, manifested as widespread acne. Previous treatments focused on resolving dampness and detoxification but overlooked strengthening lung qi, hence their limited effectiveness. Now that the condition was thoroughly understood, treatment began. The patient was treated with acupuncture. On his face, points from the stomach meridian of foot Yangming like Si Bai, Xia Guan, and Jia Che were used to clear heat from the stomach meridian. Distal points like Higu and Chu Chi were chosen to clear heat from the hand Yangming large intestine meridian. Yin Ling Quan from the spleen meridian of foot Tai Yin and Pai Shu on the back were used to strengthen the spleen and resolve dampness. Additionally, Tai Yuan on the lung meridian of hand Tai Yin and Fei Shu on the back were used to strengthen lung qi, and San Jiao Shu to facilitate the flow between upper and lower parts of the body. After 2 weeks of acupuncture, there was significant improvement. Adjustments were made to the points based on his condition, and in less than a month, the acne had mostly subsided, and no new pimples formed. The treatment was quite effective, although some pigmentation still needed time to recover. That's all for today's share. Goodbye.